Welcome to Season 4 of AIHA's podcast series, The Healthier Workplaces Show, where we explore timely and informative topics about occupational and environmental health and safety. I'm your host, Alejandro Castillo. Today, I have the pleasure of speaking with a distinguished award-winning journalist, Howard Berkes. A veteran NPR correspondent, Howard Berkes worked for 38 years covering the American West, rural America, and later serving as an investigations correspondent. He has earned over 40 journalism awards for his impactful reporting. Howard was a speaker for the Upton Sinclair Memorial Lecture at this year's AIHA Connect 2025. The Upton Sinclair Memorial Lecture is an annual lecture that highlights the importance of media in OHS. We're here today to talk about Howard's insights on the hidden epidemic of severe black lung disease among coal miners, uncovered through relentless investigative work. Howard, thank you for joining us today.
Good to be with you.
Let's start with the basics. What is silica dust and how does that cause black lung disease?
So silica dust is created when mining machines in coal mines cut through rock as well as coal. And that's been happening more and more over the years because the big coal seams are gone and what's left are thinner seams. But the mining machines haven't shrunk in size. So as the mining machines are cutting coal, they're also cutting more and more rock. That rock contains quartz in Appalachia. That rock contains quartz. And when that quartz is cut up by mining machines and cut up in really fine particles, it becomes respirable silica dust.
Let's go back to 2016. How did you discover the story that would eventually expose the failure of federal regulators to protect coal miners from this toxic silica dust?
Well, oddly enough, it started with a text message.
Wow.
I had covered coal mine safety since 2010 and a mine disaster in West Virginia. And so I had a lot of sources. And I had also covered the resurgence of basic black lung disease. We did a series of investigations in 2012. And in 2016, my phone beeps and it's a source who says that they have seen more cases of the advanced form of black lung in the last couple of months than they'd seen in the previous 20 years. And they said that black lung clinics were slammed with coal miners who suffered from this most serious form of black lung disease. And that began an investigation of how many cases were there actually out there. Because the reported number of cases by the National Institute for Occupational Safety and Health, which tracks these things, was about less than 100 cases like in 5 years. Well, we found one clinic, small clinic in Kentucky, that had almost that many cases at just that small clinic. And we quickly found, after contacting black lung clinics across Appalachia, that there were hundreds and hundreds and hundreds of cases. In doing that story, we heard from coal miners that they had been exposed to not only coal dust, but silica dust. They talked about how mining involved the cutting of more and more and more rock. And some scientists were beginning to believe that that was the reason for this advanced disease that was occurring, that as miners were being exposed to more and more silica dust, more miners were getting the advanced form of disease. They were also getting it younger, and it was progressing more quickly to advanced stages. We still had to do more work to figure out why this was happening and to learn more about the connection between silica dust and advanced black lung disease.
Would that factor in why there was such a delayed response to regulation changing this?
That's all. The failure of the federal regulators to respond to the silica dust problem, there are a number of factors for that.
Okay.
One thing that we discovered is that we went through 30 years of federal data that was collected on how much silica dust exposure occurred in coal mines. Because what happens is mine inspectors go into mines. For coal mines, they go in at least 4 times a year, and they inspect all kinds of safety things. And one of the things they do is they take dust samples, and those samples are analyzed, and they're analyzed for silica. So they had in their records evidence of overexposure to silica for 30 years. Clear-cut evidence, yeah. Because a sample will show whether it's in compliance or it's not in compliance. And so that's in there, that's in the data. But they had never looked at that data. we looked at that data. We gathered that data, we looked at it, we analyzed it, a process that took quite a while, but we did it. And so we found 21,000 excessive exposures to silica dust in that 30-year period. 21,000. Well, that can explain, because silica dust is so toxic, 20 times more toxic than coal dust alone, that can explain what ultimately was identified as an epidemic of the advanced form of black lung disease, is all those exposures taking place over the years. And silica dust is not only much more toxic than coal dust, it also, when it's ground up like that, it's like glass. It sharp kind of particles. So when they lodge in the lungs, they lodge in the lungs forever, and you can't expel those particles. And so once they're in the lung starts to react with a defensive mechanism of building fibrotic tissue, and that's why it becomes this black lung disease that is so advanced, and it eventually destroys the ability of the lung to breathe.
You mentioned defensive mechanism. I want to switch a little bit to enforcement mechanism. Why is it important to have effective enforcement mechanisms to protect workers' health?
Look, the reality is that the good companies, the companies that care about the safety of their workers and are willing to spend the money to keep them safe, or to change their operations, which might cost them money in terms of productivity, to keep workers safe, you don't have to worry about those companies. They're going to do it, right?
Of course.
The problem is that there are companies that will bend to the bottom line, that will not really care that much about their workers, and you have regulation to keep those companies in line. Regulation exists because there are companies that won't do the things that are necessary to be done, including following the law to protect their workers. And you have to have strict enforcement of those regulations in order for those companies to follow the law. They have to have a disincentive to be bad, to behave poorly, to expose their workers to risk. They have to have a disincentive to do that. And the disincentive is regulation that forces them to do the right thing, actually fines them or provides some kind of response if they don't do the right thing, so that they have an incentive to do the right thing. If everybody paid attention to worker safety law, you wouldn't need regulation. But the truth is that doesn't happen. There are pressures that companies face, the bottom line pressures of making money, whatever it is, that can keep them from doing the right thing. So you have to force them to do the right thing. And you have to have effective regulation in order for them to be forced to do the right thing.
Absolutely.
Chemical Protective Clothing 3rd edition is available now. The revised 3rd edition provides a comprehensive overview of the considerations necessary for implementing a successful protective clothing and equipment program. Scan the QR code or click the link below for more information.
I've interviewed dozens of coal miners who are sick and dying from advanced black lung disease. One of the most striking examples is a miner named Danny Smith, who was diagnosed with the advanced form of black lung when he was just 39 years old. This is something that didn't occur in miners until their 60s and 70s, but we're now seeing more and more miners in their 30s and 40s that are so sick. And also Danny worked just about 10 years underground in mining. He didn't work for 20 years or 30 years or 40 years. He only worked about 10 years, but he was involved in a lot of mining that included the cutting of rock, especially when he spent months and months and months digging through a mountainside to get to a coal seam. And he was cutting nothing but rock during that time. So he was exposed to a lot of that silica dust during that time. And he's very, very sick. At 39 years old, with this fatal disease, he worries about whether or not he'll live long enough to see grandkids, to see his 2 daughters, who he's a single parent raising 2 daughters, see whether they succeed in the world. And it's just really tragic to see what this young life affected by this. It's cut so short. And one of the things that Danny did when I visited with him at his house in eastern Kentucky, he took me out back of his house, and there's a family cemetery there. And he showed me the burial plot that he's picked out for himself. And he was only 46 years old when he showed me that. It's tragic what's happened to these miners who can't pick up grandkids because they don't have the lung capacity to do that. They can't walk down the driveway to pick up the mail. They can't walk up steps. They can't work anymore. One miner we talked to, just talking leaves him completely out of breath and unable to continue. And these are people, if you look at them, they look robust, they look tough, and they're coal miners, they were really tough. It just destroys their ability to function as a normal human being, and they will die horrible deaths. One pulmonologist I talked to said they essentially suffocate while alive, that their lungs just fail to work anymore, unless they're able to get a double lung transplant, which is a whole major thing in and of itself.
Sounds complicated, yeah.
They don't have much to look forward to.
So what regulations do we need to stop that?
Finally, after the reporting that we did and some studies that were done at the same time by epidemiologists and pulmonologists and other scientists focusing on this, the Mine Safety and Health Administration in 2024 finally did adopt tougher regulations on the exposure to silica dust. They're twice as restrictive as the exposure limit was before, and they required direct regulation of silica dust, which did not exist before. So now, all of a sudden, in 2024, there was a new enforcement mechanism, and it was stronger, and that looked really hopeful. And that's what's necessary. Unfortunately, the mining industry didn't like this new rule, in part because it not only applied to coal mines, it applied to all other mines. Mines that, are metal mines or that are cutting rock for various purposes. And they felt that it was unfairly applied to them, so they sued. And actually just, last week, a federal appeals court suspended the enforcement of the new silica regulation. So right now, at least for the time being, miners are still working under the same regulatory system that failed to protect them before.
That's devastating.
And what's also unusual is every other worker in the country that cuts rock is subject to those tougher restrictions because they were established by the Occupational Safety and Health Administration, which oversees all other workplaces other than mines. So every other worker in the country has those tougher restrictions for silica exposure, except coal miners. I think what's true about workplace safety in general is that companies and regulators respond to a lot of different motivations, right? They have pressure to pay attention to certain things and not other things. For a government agency, there may be other workplace hazards that they're focused on, and so they may not, pay attention to all the things they should be paying attention to, or they don't start paying attention to something like silica dust until somebody embarrasses them by pointing out the failures of their regulation, like we did. They may not pay attention until there's pressure from Congress or the administration, the whatever presidential administration is in charge decides that it's a priority. So one thing I've learned in all of the reporting I've done about workplace safety over the years is that the pressure really counts. And it's really important for journalists to do the reporting that holds these agencies accountable. And it's also important, I think, for workplace safety professionals to help journalists do that reporting, to provide the data and documents that they have gathered in their studies and in their research, to give them tips about what's going on that they see because they're deeply involved in that. issue, but the reporter may not be aware of, and to help the reporters understand what's going on. I mean, I really think that I know that our reporting would not have had as much impact as it had if it weren't for the workplace safety professionals, the epidemiologists, the pulmonologists, and others who gave us tips, who helped us understand things, and who did the research and provided the scientific and academic rigor that was necessary in order to help motivate the agencies to change the regulation. I think our reporting, by focusing on the miners who were dying, sick and dying, and by pointing out how the regulation has failed, that kind of shamed them. But you also need the scientific and academic rigor that's done there to provide the key information that the agencies can act on as well.
So what way can the OHS field assist in this process?
By responding to journalists when they call, by being willing to share the data and information and studies that they've gathered and their perspective, by being willing to explain and be patient with a journalist who is not so deeply involved in that field but wants to learn more, to not be willing to be silenced by their agency or company. There are gatekeepers in this field, like in any field, and they may not want you talking to reporters, but the best way to help protect the safety of the workers that you care about may be to also then talk to reporters about what's going on. The reality is that a lot of studies that are done and a lot of research that is done gets done and it gets out there, but it doesn't have much impact because who sees it, right? The field sees it.
Yes.
Your peers see it. But in order for there to be a call to arms, let's say, about something that's going on that is wrong or that needs correction, you need to get people to care about it. And that's where you engage journalists who can tell stories in ways that studies do not depict, what's going on, and who can include, like we did, the miners who are so sick and who you can't listen to those miners without feeling like something needs to be done, right? That's not necessarily captured in studies.
The emotional aspect of it.
Right, but we can provide that. So I think that there is a huge opportunity for sort of complementary work here that accentuates the impact.
The AIHA Connect 2026 call for proposals is now open. Share your expertise with the OEHS community in New Orleans, Louisiana. We are seeking subject matter experts to present professional development courses, education sessions, case studies, scientific research, and professional posters. Share your insights with thousands of professionals and build credibility while contributing to worker safety. Submit your proposal today and advance the OEHS profession for a better tomorrow. Submissions are due by September 10th, 2025.
How has the health and safety of coal miners been affected?
You have a situation in which Doge, Elon Musk, are going through federal agencies with a meat axe, firing workers, ending programs, without actually analyzing, the cost of that and the value of those programs and those workers. And that's occurred in the coal mine safety realm, both with the Mine Safety and Health Administration, which is the regulator for coal mines. The administration has put mine safety offices sort of on the market. They're closing them down. Well, that's where inspectors work. That's where people work who actually do the day-to-day work of making sure that coal companies follow regulations. Worse, I think, but also what you have is the National Institute for Occupational Safety and Health. It's a federal research agency, and it tests coal miners for black lung disease. It tracks black lung disease and the severe form of black lung disease, and it gives coal miners the opportunity to get out of a dusty coal mining job into a job without dust if they show they have black lung. And that program from the National Institute for Occupational Safety and Health was completely unended when all of the people who worked on that program were suddenly put on administrative leave and told they'd be fired soon. Fortunately, in the last week, a federal court has ordered that program to be resumed and all of those workers to go back to work. And the same day, the administration caved on that. And so at least for the time being, those programs continue. The bottom line is that this administration has made it a priority to revive the mining of coal, to get the coal industry sort of going again or going better. But at the same time, they've been cutting the programs that protect the health and safety of coal miners. And so I have said over and over again, as I've covered coal mine safety, there are people who say they are friends of coal, but that doesn't mean they're necessarily friends of coal miners.
As we approach the end of this episode, Howard, is there anything else you'd like to share with us?
I think it's important to realize that especially regulatory agencies have a lot on their plate. They may be underfunded, they may be understaffed, they may be being asked to do more. They're asked to do specific things by the administration that's in charge at the time, the presidential administration. And so some things may slip because of that, because they're doing so much with so little, and because there are priorities that they're given. And that's exactly what's happened with silica dust exposure and the failure to regulate it. And it took the reporting that we did that exposed the failure to regulate it and to graphically display the tragic circumstances as a result, the thousands of miners who are sick and dying from the silica-caused disease. It took that to get the ball moving and to get the focus onto silica dust. And that's common in so many industries and so many workplaces, that there are always things that are maybe not being paid attention to that should. And that's why it's important for journalists to do the investigative reporting that exposes those things, and for workplace safety professionals to help them with studies and tips and their knowledge and their expertise, so that the reporting has some of that scientific and academic rigor that they bring to their work.
Absolutely. I think we absolutely need a collaboration to work together.
Yeah. And, we have to be, as journalists, independent in our work. So we're not necessarily literally working like in concert, but we can work, sort of simultaneously, see what each needs and help each other do our jobs. And really, it's workplace safety professionals helping journalists do their jobs to make the journalism better and have more impact. And then it also means that their work that they've done, the studies, the documentation, the data, will have more impact.
Absolutely. I think we can all agree that a healthier workplace means a healthier world overall.
Absolutely, yeah.
Howard, thank you so much for joining me today.
I appreciate you being focused on this issue.
To learn more, visit the AIHA website and follow us on social media. Listeners, thank you for tuning in, and as always, remember that healthier workplaces means a healthier world. Until next time.